Okay, we're gonna work on baby's upper body a little bit here. So there's muscles in between the ribs, which are called intercostals. Those can get really tight, okay? And sometimes that causes that, if it's really tight, it might cause a little bit of an arch one way or the other. So what we're gonna go in and do is just kind of break that up, that tension, release some adhesions that may have formed in there. All right, so we're gonna put a little slack in that, it's the pectoral girdle, okay? A little slack in there, grabbing as close to the joint as possible, and we're just stretching up. Stretching up. Okay, and we might pump, pump, pump. We don't ever want to force baby out of a position or into a position that they don't feel comfortable in. Okay, we're not trying to hurt, we're just trying to stretch, show them that movement that they have. Okay, and if you need to, you can tap, 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 tap in between those ribs, and then you can always go back in and give it a nice stretch. Okay, remember, we're always going to do work on both sides, so when you feel like that side has been worked well, you can go back to the other side. And same thing, we're just going to stretch, stretch. And the reason we're doing that also is babies use that bilateral movement to learn to start crawling. So we're just encouraging what is most natural for them, okay? So when you feel like you've had some really good stretches there, you can also do that side body stretch with them on the table. You can just bring them a little bit closer to you, and you're going to stick your hip up against the table, grab at their hip and grab at their, like right under their armpit. You're going to bring them to you and just kind of like, you're going to fold into a letter C. Okay, I'm really opening up that side body. Okay. This one I've also showed you on my lap. I can come around and show you that. And the same thing, I just put baby close to me, okay? And I'm grabbing at the hip and under the armpit, and I'm just bringing him towards me. I'm not pulling hard. Again, we're just going until we feel resistance. We might hang out there for a couple seconds, come back. You can do the tapping here if you need to, and then come back to that stretch, okay?